Year, everyone. Happy 2025. It's really, really nice to see so many folks, people I've seen in the past and new people that I haven't met. If you don't know me, my name is Azia Ermias. Everyone calls me Azi, and I am now supporting the DULCE work with the team here at CSSP. So this is our January call. And just as a reminder, we have these quarterly calls for the full Dulce network as a way to bring everyone together, share new ideas, problem solve collectively, and just get to know one another in a nice formal way. So just by way of introductions, I introduced myself, but I wanted to allow Shadi from CSSP to briefly introduce herself. She is kind of spearheading and leading some of the health justice work at CSSP. So Shadi, if you wanted to introduce yourself.
Sure, I'm happy to. Hi, everyone. It's so nice to be here with you all, see your faces. I'm Shadi Hushair. As Ozzy mentioned, I lead our health justice policy work at CSSP, and I'm partnering with Ozzy and the team here to support the work of the Dulce Network. I was actually involved with Dulce years ago when I first came to CSSP, and so may have connected with some of you, but I'm really excited to be back in and to just see the evolution and progress of the network and all of your communities. And excited to be here. Yeah. Thanks, Ozzy.
Thank you, Shadi. And then there are some other folks who are really supporting the Dulce community and the Dulce work along the way. And I wanted to give them some time to briefly introduce themselves. So Amy, maybe we could start with you and then Brina and then
Sure.
Jane.
Um, Good afternoon or good morning, depending on where you are. My name is Amy Copperman, and I'm the Executive Director at MLPB. For those of you who've been around with Dulce since the beginning, MLPB was part of the origin story of how Dulce came to be, and we participated in the randomized controlled trial that led to the model that is, now all over the country today. So I've been at MLPB 2 years. And today we also have the fortune of being the legal partner for 4 Dulce sites in Rhode Island.
Thanks, Amy.
Hi, everyone. I'm Brina Holmes. I'm a pediatrician in Vermont. I was part of not the actual origin story, but when the first rural site came to the Lamoille Valley in Vermont, I met my friend Scott Johnson, who I see is on this call, and he and I decided that this was the approach we were going to partner on for he as a community leader and me at the time as the maternal and child health director for the Vermont Department of Health. I've since switched over to the Vermont Child Health Improvement Program where we hold with Rachel Wallace-Broder, who's here on this call, the continuous quality improvement parts of the 9 Dulce sites in the great state of Vermont. Happy to be here.
Thank you, Brina.
Hi, everyone. This is Jane Singer, and I am here in the very frigid part of New England, of Boston. I know where Amy is. Brina, it's even colder where you are. Some of you on here are also in very cold weather right now. I'm delighted to be here. I'm a clinical psychologist. I'm the director of clinical training at the Brazelton Touchpoint Center, which is at Boston Children's Hospital. And I've had the honor to come alongside the first full cohort of family specialists from the time, it's not the very origin story, but the first rollout of multiple sites after the pilot Dulce model was established in Boston. So I am thrilled to be back with you and to see so many familiar faces and to get to meet additional people. And I'm here on the national team to really support developmental relational care through the application of the touchpoints approach and the newborn behavioral observations in your Dulce implementation. So thank you for welcoming us to your community.
Thank you so much, Jane. And thank you everyone for introducing themselves. So as we kind of get started, I wanted to talk through just some brief Zoom etiquette to help make things move kind of smoothly. We have everyone automatically muted, but you do have the opportunity to unmute yourself at any time if you would like to ask a question or just, hey, stop me if I'm saying something that just isn't making sense. So feel free to use that unmute button anytime. If you could please have your first and last names displayed clearly so that we are all aware we're creating breakouts and we want to make sure we have everyone's names clearly visible. If you are dialing in through a phone, which I'm not sure I see any, but if you are, just make sure your name is clearly there. And as I said earlier, please join by camera if you are able to. We'd love to see your faces. If you run into any technical issues, feel free to send me a private Zoom chat message and I can help address that. We are going to be moving into breakouts, so keep that in mind if you run into any issues. So this is a large group, and we like to have just some group norms or group agreements to keep top of mind as we move along here. So this is a space for all learning and all teaching. We also do want to be mindful of our level of participation so that folks feel comfortable to kind of share. We love to replace judgment with wonder, just to wonder and learn. We own the intent and impact of our work and that of others. We like for everyone to speak their truth, and for your experiences are all important to us, especially with this work. And then finally, just participate and have fun. That's what we like to do here. So for today, just the main purpose of our day today is to get you all together for the first time in 2025. We have some new communities in the group. We have our veteran communities in the group, and we have the CSSP team here. So we just want everyone to get together and know one another. And then we're going to dive into some breakout groups around some select topics where you all can chat and problem solve together. So this is what our agenda looks like. You all will have about 30 minutes in each of your breakout sessions. You'll have 2 rounds of breakouts that you can select into to talk. Those breakouts will be facilitated by a member of the team. And then there will be a large group breakout room discussion where we will get together and kind of debrief about what was discussed and what was learned. Okay, so before we dive in there, we know that this is a new group coming together. So we are going to be putting you into breakouts of 3 that you all have been randomly assigned to. During your breakouts, we invite you to share your name, share the state that you live in, share your DULCE role, and a fun fact about yourself. And then as part of your discussion, we want you to talk a little bit about what you most appreciate about DULCE, and also what you most enjoy about working with the families that you serve. So you will have around, I would say, 3-4 minutes, let's say 5 minutes together to kind of introduce yourselves and talk through these breakout group discussions. Okay, and with that, Shadi, I will invite you to put them into breakouts.
I am just moving folks to a couple of different places and then I'll open it up. Just want to make sure I have good numbers for everybody. I think I've done that. There's a couple of you where there's only 2 people in a room. So let me just make those moves too, and then we'll be ready to open up.
And national team members, Jane, Brina, and Amy, will have you stay in the main room.
Okay. So I have it. I'm going to send you all into rooms. Please go ahead and then we'll come back. We said in about 5 minutes. Is that right?
Yep. Yeah.
Ozzy, I'm going to stay here even though I was assigned
I
to a
put
room.
you, yeah, I put you and Amy and Jane into one room so you all can just stay here instead.
Okay, going over now.
You don't have to move. You just stay.
Think you're going to have to shift her back, Shadi.
Oh, I am. I think you just don't join. Isn't that a
But she did.
option?
I can
Oh,
join
she
it now.
did. Okay, I see what you
She
mean.
did
So
it.
then I have to move her back in to the main
Just
session. Got it.
kick her out.
Got it. We're
Yep.
Ozzy and I were both joking. We're kind of novices at this breakout room process. So I was like trying to move people. There's not like a great way to keep people in the main room. I had to move. The only way I could do it
Uh,
was to move you into a room. So I was
Yeah.
trying, and I also want to make the rooms even. So took a
Right.
no,
little.
you did, Shadi, you did great.
Yes.
Jane knows my story that we do touch points sometimes without tech support, and I have learned the hard way how nimble Jane is. My goodness, that's hard. The whole we just did yesterday, vote with your feet, where you have to put each principal as its own breakout room, and then
Yeah. And you
zero,
can't
ze
set it up ahead of time.
no, and zero
Yeah.
people join, and then there's one or six. Everybody went to using child's behavior. Isn't that funny?
Ooh,
That's the one that you go
excellent.
to, right?
And then you have to
Uh-huh.
move people
And then
manually,
Yep.
or
it's
did
like, no,
you?
you can't have six. And then
Yeah.
Right. Then you
they
have to
were,
So
shift people around. Yeah.
it was,
Ozzy, did I think we've got okay.
Yeah, I
Um,
moved in Sarah into one.
okay.
Right.
Yeah.
Are you timing? I just
Yeah.
started a timer. Okay.
Mhm.
So if you want me to broadcast, I can
I
at
already
some
did.
point. Oh, perfect. Okay, you're on it.
No worries.
So
I
what's a fun
private,
fact about you guys?
Hmm? What?
What's a fun fact about all of you?
ooh, that's a
We're
good,
doing fun facts.
Get us started, Jane.
A fun fact about me. I used to be a clown in a clown troupe.
What?
oh,
Are you for
that's
real?
a
That's a good
good
fun
one.
fact. That's a really good fun fact.
When was
I
this?
don't think we can top that. So
When
I
I
think we'll
was
just
like
stop.
16 to 18, when I was in high school.
Oh, Jane, that's so
Yes.
good.
Do you have photos, Jane, that you can share?
Yeah, I'll have to
Oh,
dig them up because
yes.
they're not digital.
Oh,
Okay.
Take a
that's,
picture
they're
with your
not,
phone.
That's
Yeah,
amazing.
yeah,
oh, that's a good one.
Wow, who can top
yeah.
that? My usual fun fact is so boring compared to that now.
Yeah. Yeah,
I,
mine's pretty
as
boring.
a practicing attorney, I was actually laid off in 2010. That's not the fun fact part, but what I did was I went to culinary school.
Oh, that is a fun
I
Nice.
fact,
have a
though.
culinary school degree in addition.
Ooh. Hey, are folks not here? Is Amy a little distant for you guys, or is that
Oh
me?
no, is that
Amy is a
better?
bit
It's
A
different.
yeah,
little
it's
bit.
it's
Shoot.
not
Is it
terrible, but
Is it better now? Wait a minute. Just out of curiosity, is this better? Is this better at
Mm,
all?
It's kind of the same.
same.
Yeah, it's
it's
about the same.
I wonder what's going on with my computer. Wait,
It's
hold on.
fine.
yeah,
Yeah.
it's not terrible. It's just it feels a little like muffled, like you're in
How
a
about now?
soundproof
Oh,
there.
there
Yeah.
you go.
Yeah. All right, I'll just leave these off, but yeah. Sorry about that.
That's okay.
I don't know why sometimes my Zoom decides to like reduce the mic volume without
Mm.
my permission. It just like randomly does it.
Uh,
I don't understand why, but
No, the
mysterious.
vagaries. Yeah.
Okay.
any other fun facts?
Just and heads up, I'll be closing the breakouts in 1 minute and I'll send them a message.
Okay.
Get those
I
fun
have
facts.
fun facts, but I also want to tell Jane that at 9:30 this morning we began a touch points training with 17 doctoral nurse practitioner students at UVM,
Oh,
and I
nice.
can't even, Jane. I They come in heady, right? Because they're in an academic setting and they're going PhD.
Yep.
So but they're really, because they're all clinical nurses who have decided to go on. It's such a cool group. I'm on
I
fire up
bet.
here.
I
Yay.
bet. And they haven't yet created their doctoral
Oh no,
thesis
they're in their
projects.
first semester.
Yeah. So who
And they
knows
have,
what will
and
come
it's
of
up,
this, Brina?
and they only have this little pediatric semester, and we're only a part of the,
Hmm.
so say it's 9 to 12, we do 90-minute, module one while they did the asynchronous, and then we did the perspective taking activity, and then they go right back to like learning about bright futures and preventive service and
Hmm.
the developmental milestones. And I feel like I'm in the best mood today. My
Oh,
fun fact is I prepare all year for the Academy Awards. There now, you know. I
oh, do
watch
you?
every movie. I know every movie, every.
Oh,
So far, I've
Have you
seen
watched Amelia Perez?
not
That's on the
yet,
list, I
Yeah,
think.
but
no,
I
I
will.
have. That is quite a film. As
Yeah,
is Honora. I recommend Honora,
Yeah.
sort of, sort of.
I have not seen that one. We'll put it on my list.
Hey, think folks are trickling back in. Let's see. Still coming back. There we go.
Still here. That's nice.
All right. Hoping you all found that breakout opportunity with someone who may not be in your community informative and fun. And we learned some interesting fun facts in our breakout group with the team here. Jane, I hope you don't mind sharing maybe yours, which I thought was really cool.
my fun fact was that I used to be a clown in a clown troupe
And we,
along when I was a teenager.
yeah. And we were like, yeah, we can't top that.
No, I think it just kind of ended it.
Yeah. Thanks, Jane. Really appreciate you for sharing. Okay. So we wanted to use this opportunity to reintroduce ourselves as CSSP because we have some new communities that are part of the group, and we also have some veteran communities who may be interested in hearing this piece again. So I'm going to turn it to Shadi to kind of tee us up here.
Great. Thanks, Ozzy. So, for those of you who are newer to the network and to CSSP, we are a national nonprofit. We're based in Washington, D.C. CSSP's mission is to achieve a racially, economically, and socially just society in which all children and families thrive. We work at the community level, at the systems level, and the policy level. In our policy work, which is where I do my work, we blend historical analysis, policy research, community partnerships, and practical and strategic action to advance our priorities. And really, in all of our work, we partner closely with families, with young people, and with communities. And I wanted to share a little bit about our strategic planning process, which we just finished, and a little bit about what that includes. So our strategic plan really maps out our long-term commitments and guides our work in the coming years. And so if we go to the next slide, I can share a little bit more about that. So this visual is CSSP's North Star, which reflects, again, our commitments, which are to achieving economic justice, health justice, and promoting family support, dignity, and autonomy. And as I mentioned, we take an anti-racist approach in all of our work. So you'll see racial justice throughout all of the pieces here. And I wanted to just talk a little bit about our health justice priorities. This is where I focus my work and also where I see really deep connections for Dulce, although I think we see the potential connections for Dulce throughout our work. So to advance health justice, we're really focused on thinking about developing and implementing strategies that humanize the way we support the health and well-being of children, youth, and families. We're focused on centering what we learn from research on development, on identity, on culture, inside and outside of healthcare systems. And specifically, some of the areas where we'll be focused around in the coming years are around developing and advancing public policies to effectively support really responsive, nurturing care for young children, and doing that by adequately and appropriately supporting their caregivers in meaningful ways. And so we'll be developing a series of policy briefs and ideas. Some of these will be focused on issues like addressing parental stress. So that's one area that we're focused on. Another is around preventing and eliminating unnecessary barriers to supports for families. We often see families really struggling to get the supports that they need. And so we're looking at and trying to counter those attempts to limit the uptake and access to critical government programs for families, including efforts to impose or strengthen work requirements on programs like Medicaid, which will inevitably be something we'll see in this administration. And then the third is around really promoting the safety, health, and well-being of immigrant children and families. And so we'll be developing some concrete strategies that support the inclusion of immigrant families and policies and programs that impact family health and well-being, and really focused on keeping immigrant families together in the United States. So these are just some of the areas we're going to be focused on when we think about health justice. And again, we really see DULCE as well aligned with our commitments to health justice, our longstanding work to improve supports for families and to promote the health and well-being of young children and families. And we see clear alignment with DULCE to all of our priorities around economic justice, family autonomy, and we're really eager to kind of make those connections as we move forward, and really put into action some of the areas we're focused on in our strategic plan. So we can go to our next slide. And so I just wanted to review here DULCE's mission and vision. As you all know, DULCE's mission is really around transforming the way families with infants experience the delivery of supports and services. And this is done through really a collaborative approach across early childhood, health, and legal systems. And the ultimate vision is that when DULCE is fully implemented nationwide, all families with infants will experience holistic, connected, responsive care and supports that they need to provide newborns with a healthy start in life. And again, just making one more connection at CSSP as we look so into 2025 and beyond, we do see really important need and opportunity to protect and promote health and well-being for pregnant people, for parents, for families. We know research has shown us what the toll of stress is on caregivers, for parents in particular who face economic hardships, really that ongoing stress that's associated with poverty or financial strain really adds to the challenges families and parents feel daily. We know that during the postpartum period, many families experience even greater financial hardship, and parental stress is just at an all-time high. So we really need systems and supports to be responsive to families, to help reduce their stress, to protect family health and well-being. And so DULCE is really a valuable approach here because it does all of these things, right? It supports families with infants, it helps reduce parental stress, it provides families with the resources they need to lead healthy lives. So DULCE is really a key vehicle by which we can support families, and also where we can draw on lessons learned to help inform policy changes that we want to advance in the future, whether that's kind of an immediate or really if we can sort of build that groundwork for future more meaningful change in the coming years. So Ozzy, I'll pass it back to you.
Yeah, thanks, Shadi. We thought it would be helpful to kind of talk through DULCE's journey, its unfolding journey, its ongoing journey for many of you. And that story began in 2008 when CSSP was tasked with leading the Quality Improvement Center on Early Childhood. And part of that work involved supporting the early randomized control trial that provided the evidence base for DULCE in 2010. The results from that led to a paper published in Pediatrics around DULCE's impact. And CSSP was extremely interested in replicating and evaluating the Dulce model. They identified 5 Dulce communities who were at that time part of CSSP's EC Link group. And those original sites then went on to 3 years of testing. And over the 3 years, we learned a great deal from those communities, and we saw the impact of Dulce locally and among families. And so, again, we were tasked with growing Dulce, replicating the model in additional communities. There were 3 more years of support and funding that Dulce received at that time, beginning in 2008, to continue to spread the Dulce model across the nation, to refine the model, and also for us to standardize our technical assistance approach. And so from 2018 up until 2020, when COVID happened, we brought on an additional set of communities who were specifically interested in looking at Dulce being adapted in the prenatal space and also past 6 months. And then from there, we are here. So from 2020, 2021, 2022, we've been growing the Dulce footprint nationally. We've been testing the prenatal and post 6 month adaptation. And as Shadi kind of laid out, we're really interested in continuing this journey forward, strategically growing our footprint nationally, and continuing to serve families, particularly in times that could be stressful and harmful long term. So I hope this slide is helpful to you all. I will be sharing this out with everyone as you get a better sense of the Dulce growth and journey. So currently, this is where we are all located, where the Dulce communities are located. We are in California, New Mexico, Mississippi, Rhode Island, Vermont, and Florida. And we're just eager to continue growing that footprint. Just as a reminder to you all, our technical assistance is housed at CSSP, and we will continue to provide you all with technical assistance around anything you need related to implementation. Our Dulce partner portal, which is on this website here, and the password is listed there, has all of the resources that you all could need to support your work. And then we also have our Dulce Learning module, which is on talentlms.com, where you all can find training videos related to Dulce. This is specifically could be helpful to our newer Dulce sites. Okay, so there was a lot of background and a lot of information there, but we wanted to make sure that we started 2025 off right with you all getting a better sense of CSSP, our goals, a little bit about Dulce, the Dulce journey, and where we're currently located. Now it's time to get into breakouts, which I think you all will find helpful. You all will have the opportunity to select into breakouts. So on the bottom of your screen, you'll see a breakouts button. If you click on that, you will see 3 breakout groups that you can select into. There will be 2 rounds of breakouts. So if you don't get to join breakout the first round, then you have the opportunity of joining the second round. We will potentially be capping breakouts at 15 participants. And so we may have to move some folks if one breakout is overflowing with people. Okay, so these are the breakouts. Breakout group 1, that will be on the value of Dulce parent advisors. Strategies to leverage to inform work and support families. We'll have our Vermont crew, a team from Vermont share a little bit about their strategy, and our friend Rachel Wallace-Broder will help facilitate that conversation. For breakout group 2, the session will be around approaches to financing and sustaining Dulce. So Brina will be spearheading that conversation. And breakout group 3 will be around understanding the evolving roles of Dulce legal partners and mental health leads. and we have Jane and Amy spearheading those breakouts. So I've opened the breakouts. If you click on the breakout group button, feel free to select into breakout group 1, 2, or 3 for this first round. This first round will be around, I would say, 20 to 25 minutes. I'm just looking at the time right now. So yeah, feel free to join as you would like. If the breakout group is overflowing with people, we may have to move you. If you have any technical issues, just stay in the main room and we can help move you into a breakout or assist in any way. Everyone, welcome back. I hope you found those breakouts informative. I know there really never is enough time to get into some of the deeper conversations, but we hope that this at least gets you all started around the thinking. And as you develop relationships, you'll be able to connect with your colleagues across the nation around some of these topics. Let's just have a bit of time and make a bit of space to do just a short report out from the different breakout groups about maybe what was discussed and maybe one thing that was learned. I'll start with breakout group 3. Let's start from the bottom up and have maybe Jane or Amy share what was discussed and what they learned, or someone from that group who wanted to report out.
I had told Jane and Amy that I would be happy to step in for that. So I would say that the biggest overarching um, discussion was, obviously the importance of mental health and legal partner and being able um, to utilize those roles in order to strengthen the overall knowledge of the team, but also how the team themselves can kind of lean on one another. As we're talking about, especially, over the last few days and throughout, the next 4 years in this new administration, um, the push and pull and the chaos that is going on is going to be, will become typical. Amy was saying relying on the legal partner because, we can kind of look at that and we can tell you like, this is noise, the chaos is purposeful, this is what's happening, and keeping them updated. Whereas like the mental health and like the rest of the team, like they're kind of there to help us, um, not necessarily like to distribute the load of like what that like the mental load that it takes on everybody, but kind of helps us give have tools in order to deal with this overwhelming sense of what we're doing in Dulce, how this affects the families and how it affects us in the long run.
Thank you so much, Brianna. What beautifully summarized, and what a tribute to the teams that you serve and the other teams that were represented in the discussions. Overarching take home of how important it is that the various roles are supporting each other in being able to stay in there and do the work. Right? So the support for families, no doubt, and being able to have the roles really complement and integrate with each other in service of that overwhelm not becoming so overwhelming that people, walk away from doing the work that needs to be done. Thank you.
Thank you, Breakout Group 3. And thank you, Jane, for that nice summary as well. Okay, Breakout Group 2. Brina or someone from that group want to share out?
Yeah, we had a similar, I mean, we went right into the different buckets of, I call it a scavenger hunt that you can do in the state, in your state to find partners and leaders who understand what Dulce is in its universality and its public health and its health-related social risk, its racial justice. And also we struggled because every time I mentioned a funding source, I had like dyspepsia because I knew it was federal. And I got all tangled up. We all did a little bit about Title V and HRSA and Medicaid, and it's just a it's just a mind-blowing experience. But we decided to keep on keeping on.
Hmm.
But boy, were we lucky in our group because we had New Mexico and Tampa and also Rhode Island. And Rhode Island and Vermont, of course. Rhode Island has a tapestry approach and some unusual funding, and we were able to share that. And then, as folks know, New Mexico has philanthropic dollars with the Hilton Foundation, and our friends in Tampa are using child welfare. So it just reminded us that we're never going to just get this, you know, big bundle of funding to do. It's always going to have a tapestry, which is a positive way of saying cobbled together, and also the braiding and blending that we have to accept a lot in things that work that are good for children. And really much more to say. I think each state needs to find friends, find some partners in public health, in Medicaid, in their health reform teams, and just promote the approach before they go in asking for cash. So anything else? Our group was great. It was had a core for the whole time, and then a few folks came the second round. Anything else, team?
I took copious notes and I hadn't even thought about using Title V or like leveraging those relationships with Medicaid. So I have some great ideas of how I'm going to be able to find more funding here in New Mexico. Thank you, Brina.
Good, good, good. I love hearing that. Okay, breakout group 1. Who would like
So yeah, we had a really nice discussion. We're able to share the work with the Vermont Family Advisory Council and some of the work that they've done in QI, which kicked off some other really interesting discussions about engaging the legal partner, which is work our group is working on. So we're able to talk about that. Heard about, there's some discussion about exit survey. So in Vermont, our advisors developed a new exit survey to capture parent experience, which really ties in with the DULCE goals and touch points, principles, and assumptions. And also really excited to hear in the future about New Mexico's work with their community-based peer support group as that gets up and going. So just really nice, as always, to kind of hear across different sites their experiences and what they're working on.
Thank you so much, Rachel. And thank you everyone for sharing out and participating in these breakout groups. It just reminds me the power of Dulce, the power of the cross-sector collaboration that allows for learning across different tentacles and different avenues. So I hope you all found this helpful and informative. Okay, so we are closing out. On our way out, we invite everyone to share in the chat one thing that they learned. Anything, even just a comment, we'd love to hear from you. And then just as a reminder, our next call is on March 20th. And we will send more information about that. In the chat box, I'm going to now put an evaluation that we would love for you all to complete before you leave. Dulce has this culture of improvement, and we are always wanting to improve and make sure that our technical assistance in these calls meet your needs and meet some of your goals. So please complete that on your way out. And please share anything you learned in the chat on your way out. Thank you so much for joining our call today. It's so nice to see everyone. Thank you for participating. Thank you for our team members, Jane, Brina, Amy, Rachel, Shadi, everyone for supporting the work. And yeah, have a lovely, lovely day and lovely end of the week, everyone. Thank you.
Thanks.